Hello and welcome back to the conference, everybody. Good afternoon. I'm Gurdeep Ahluwalia. Let's get right into it. With apologies to Dr. Oz and the cast of the hit show, The Doctors, they have not been the stars of this pandemic. They have not been the names, the faces, and voices that you have come to trust and lean on over the last 15 months. The specialists you're about to meet, they have been front and center in this pandemic from the start to, well, wherever the heck we are now in the timeline of the pandemic. You hear from them every single day, but what do these docs think about, their sudden role in journalism and influence in driving the daily narrative? What about dealing with social media and misinformation in the era of the 24-hour news cycle? And what advice might they have for us, the journalists, after seeing us do our jobs up close from afar over the past year? There is a light at the end of the tunnel. Let's just hope it's not a freight train. It's time to meet the panel. All right, first off, top right corner, we've got Dr. Ruchi Murthy, infectious diseases specialist, Queensway Carleton Hospital in Ottawa. Good afternoon, Ruchi. We've got bottom left corner, Dr. Isaac Bogosh, infectious diseases specialist, Toronto General Hospital, and a member of Ontario's Vaccine Task Force. And that leaves Dr. Naheed Dasani, palliative care physician and health justice advocate. Good afternoon, everybody. Thank you so much for sharing your what little time you have left in your lives here to do this with us. We really do appreciate it. And just a reminder, if you do have a question for the doctors, you'll notice to your right is something called Meeting Pulse. If you see the agenda there, scroll down and you'll find the Q&A tab. Make sure you sign in and you can type your questions in there and you can see what other people are asking. We'll get to your questions towards the end of this hour. All right, so let's get right in. I want to warm all of you up with a question for all three of you right off the hop. In terms of how you guys started doing regular media, what was the genesis of that? Did you have to seek out that opportunity? Did it find you? And did you actually get any media training before you started appearing in front of the camera? Ruchi, go ahead.
So the easy answer is no, there was no media training prior to coming on camera. I will say that most residency programs across the province include communicator roles. So you have to have some level of communication training through medical school. And so that's the extensive communicator training that I've had. In terms of my personal experience getting involved in media, it started out at the beginning of the pandemic when I was 34 and a half weeks pregnant. I think I did my first media bit at that time talking about social distancing, if you will. It's now become such regular semantics in our lives, but that was the concept that I initially had to debunk for a news channel in Ottawa. Following that, I became a little quiet. I had other things that were on my mind and other issues to deal with. And more recently, my involvement in the media has been mostly through social media and bringing light to issues that surround pregnancy and the pandemic and things that I take seriously, and hopefully voicing those concerns and issues through various media forms.
Dr. Bogosh?
Yeah, I'm an infectious disease physician and scientist, so I work very closely in the realm of, COVID-19. But prior to this, a lot of my work was on other communicable diseases, epidemics of global health significance. So I got my first real taste of media in 2014 with the West African Ebola virus outbreak, and I'd done a lot of work from a scientific standpoint on that, and some of that made it into the media. And certainly there were a lot of questions about exportation of Ebola virus and how this was going to impact the world. And then again in 2015, 2016 with the Zika virus, a huge epidemic in Latin America and the Caribbean. Again, a lot of the work I was doing at the time was focusing on emerging and re-emerging infectious diseases such as that. So that got a lot of media attention as well. And I remember doing a lot of media around that time, especially pertaining to Canadians with pregnancy and travel and all those other issues. And then again, I've done a lot of work with obviously with COVID-19 from a scientific standpoint, and my initial taste with the media was through that, and then that expanded into other roles that I've had with the federal, the provincial government, and just I think explaining what this is to the general public because there's been so many questions.
Okay, so it's been a real progression with you and Dr. Dasani.
Yeah, for me, I've over the years since 2014, I've been doing media in different ways as a physician providing healthcare for people experiencing homelessness to, bring perspectives of what life is like on the streets as a palliative care doctor, what it's like to live and die in the shelters and in different settings. But no, didn't per se have media training, but had an active social media presence. So it kind of just started with me around a story around how COVID was impacting people experiencing homelessness with serious life-limiting diseases, and following them. And, these were people who were dealing with difficult circumstances before the pandemic and what that meant after. And then I think things evolved over time, and it started to become a conversation about people thinking about their mortality more and more. And so I, did another kind of interview talking about advanced care planning and, thinking about your future because you might get sick. People, are thinking about these issues, and it just evolved one thing to another, and it became like print, digital, radio, and I think over time, my role in this kind of morphed into becoming a health equity, analyst, looking at health equity issues as it pertains to COVID, because it certainly did not affect us all equally. The communities that were hit hardest were racialized people who were living in poverty, people who were, on the streets, people using drugs, people experiencing mental illness, and just being, all over all of those issues. It's been a ride for sure.
Okay, there's a lot there for all of you. Appreciate that. Now that you're all warmed up, Dr. Bogosh, first question here is for you. I went back and checked my notes. You may not believe this, but you have done 286 hits on CP24 breakfast, most of them with me. I have taken a couple of days off. That's at 7:20 every morning. Most of you watching and listening probably already know that. And in true COVID fashion, Doc, you and I have not actually met in person, but we both kind of feel like we know each other. We've got the bromance thing going. And when this is all over, you and I are going out for fried chicken sandwiches and a beverage. Look, you've really blown up in the pandemic. I know you're a humble guy, but that's a fact. After you started with me on breakfast, you started popping up on CBC, Global, CTV, City TV, all the major print media, even The Athletic, to talk about COVID-19 in professional sports. And then the King Daddy topper was you showed up on CNN. At that point, seriously, I thought we had lost you. I didn't think you were going to come back to us, but you did. Were you doing, you kind of touched on it already, but, I'm curious what this experience has been like for you. And now that you've been doing this, every single day for more than a year, how do you find time to do actual doctor things?
Yeah, obviously, it's been an extremely busy pandemic. In all fairness, most of the media I do is really at the very beginning of the day or at the very end of the day. I don't do a ton throughout the day because during the working hours, I'm in the hospital. I've got patients to see. I've got patients to see on the ward. I've got patients to see in a clinic. And then of course there's these other huge time sucks, like various task forces and committees at a federal or provincial level. That just takes up a ton of time. I try my best. Like, obviously I appreciate that there's no free time during this pandemic, but I still try to carve out a lot of time. Like something has to be very, very important to land within the 5 p.m. to 8:30/9 p.m. hours. Like that's really, time to be at home. I've got 2 kids. I really try to have a dinner at the table every night. Obviously it doesn't work out very frequently, but I try my best. And, try to put the kids to bed, read, go on bike rides and have some semblance of a life. But yeah, I mean, safe to say, like it's been an insane pandemic. And it's not going to pretend it's like a healthy lifestyle by any means, but I really try to get a lot of the media done at, between 6 a.m. and maybe 8:30 a.m. and then have the rest of the day for plenty of other things to do as well during that time.
It is impressive how you do find the time to make it all work. Dr. Murthy, next question for you, and perhaps this is something I should have asked right off the top, but I'm not even sure if the public actually knows this, but what does an infectious diseases specialist do? I don't know if we ever asked that question, not being in the profession, before a pandemic like this.
I think that's a really important question, and I think I'm grateful, I'm sure Dr. Bogosh is as well, for the opportunity to explain that a little bit to journalists, because it's sort of a black box. The assumption is there's an infection out there, there must be an infectious disease specialist to address all the issues related to this. But the truth is all of us wear such different hats and have taken on such different roles throughout the pandemic. There are some that are more involved in clinical work, seeing patients, giving advice on a one-on-one basis. There are others that are involved at the policy level. There are others that are involved in the scientific realm. And so everyone is really wearing multiple hats and taking on multiple roles. Prior to COVID, an infectious disease doctor really mostly works with various infections, viruses, fungal infections, bacterial infections, parasitic infections. And so we talk about bugs and drugs and how we address those issues for people that are sick in the hospital, and therapeutics involved in that. And so within that scope as well, there's community physicians and academic physicians, so those that might work in a community hospital and those that have more university responsibilities. And so the caseload varies based on that as well.
Only took me 15 months to ask that question. Appreciate that, Dr. Murthy. Dr. Dasani, next question for you. I'm sure if people are on social media, they are familiar with some of the work that you've put out over the past 15 months. You've really leveraged, various platforms, TikTok, Clubhouse, which I'm not sure everyone is familiar with Clubhouse, and Twitter to get your message across. What platform have you found to be most useful in terms of, educating people, having a healthy dialogue, and really getting, crucial information out there quickly to the masses? Is there one platform that's sort of been your go-to, or do you sort of pick and choose based on what type of content you're getting out?
I think that's a really fabulous question. I wish there was kind of like a one, color I could paint this question with. And the reality is when you're using multiple platforms and you're conveying different messages, you're really trying to meet people where they are at. And, I found with TikTok, I found it to be really effective, particularly for people who are under 40. A lot of my friends were not watching the press conferences in the middle of the day, and using TikTok is a quick hit, to like 20 to 30 seconds, music, text, relaying a complex message. I never actually danced once in any of my videos, which I'm very proud of. But that was really cool, and you can get a lot of views. I was looking earlier, like 150,000 views on some of my videos on physical distancing and how COVID doesn't affect us all equally, or here are the new Health Canada guidelines. I found Clubhouse and Twitter Spaces to be really effective for building community. There was a time in the pandemic where people wanted a little bit more. They wanted to feel like they were part of a community and they could dig a little bit deeper with people. For people who are not familiar, these are live audio social media platforms. We started healthcare in Canada. We have like 7,000 followers on Clubhouse. We run, weekly events on Twitter, and we've had an incredible, response. People just want to learn more. They're yearning. And I think for people who are more of the long form, sitting through a conversation and really getting in the depths of it, that's been great. I still find Twitter, the text, like the hit you can have really quickly to reach a lot of people. And then Instagram, never, questioning the idea that you can import videos from TikTok and also, post pictures as well. So, it's not that one platform's better than another. It's who's your audience, who are you trying to reach, why are you trying to reach them, and then picking the best platform and the way to convey that message in a way that's most effective. If I have one piece of advice for journalists, we've definitely seen, health workers, physicians like myself pivot towards using these platforms in this way. I think for future health topics, it might be useful, to see the media also pivot in that way. Think about live audio, think about TikTok, think about these platforms.
No better time for a shameless plug. If you're not following him already on these various platforms, it's at Naheed D. And we actually have a taste of something you dropped on TikTok a while ago. Let's have a look at that. A really simple message, right? But effective, and you kind of can't look away. And you're doing exactly what you said there. You're meeting people on the platforms that they actually use, as opposed to, listening to a 1-hour news conference on CP24.
And no dancing required, the best part.
That is the best part for all of us involved. Fair enough. Okay, Dr. Bogosh, question for you. Do you know, or did you know, how many Twitter followers you had at the start of the pandemic?
Not many. No. So, I don't know, 500?
Something like 500, right?
Yeah.
At last check, and I don't know if I'm sure you don't stay on top of this stuff because you got more important things. Do you know how many you have now?
100,000? 110?
125,000 at the last time I checked.
Wow.
That's
full disclosure.
Yeah.
I mean, appreciate, I like what Dr. Dasani said. I think that's amazing. And I fully agree with everything that he said. We all come in with our own personal opinions and personal biases. I despise social media. I really don't like Twitter. I joined because several of my colleagues were saying, you know what, you're getting left behind. You should really join. I joined in February 2019, begrudgingly. And I truly think as a Twitter, I can't speak for other social media platforms because I'm not really on them, but I think Twitter is net harm. Like, it's just awful looking at what's on there. Maybe we'll pivot in this direction and look at, misinformation amplified. And like, I go on, if I see something interesting, I post it, I scroll for a minute, I lose faith in humanity, and I shut it off and I get back to work. Like, it's just, like, I was going to say, have you seen what's on there? But of course you have. Like, it's crazy. So anyways, it's great to have all those followers. But like, quite frankly, when the pandemic starts to settle down, which it already is, I think I'm going to scale back significantly.
Well, it is a really effective medium, especially the way you've been using it, because, I think people tend to think of Twitter in sort of short form messages, but you've created these incredible threads where you'll put out 8 or 9 messages where you will get out sort of a long form message, and you'll hook people in with that first one. And then we have to read your subsequent threads because we just have to know what Dr. Bogosh is going to say. I think we actually have one of your Twitter threads up. We'll just have a look at sort of how you've been utilizing that. Nothing embarrassing, Doc. This one is from, this is pretty recent. This is from May 27th. I hope that's, yes, this May 27th, yes, because you're talking about a second dose. So look, I mean, if you were a stock in this pandemic, you'd be Tesla in terms of your growth, right? I'm not going to use GME or AMC because there's actual rationale as to why you have blown up in this pandemic. So that's great stuff in terms of how you've leveraged that. Dr. Murthy, I want to get to you next. When people turn on their TVs, or consume COVID news on their phone, like we all do, like Dr. Dasani was just telling us about. I've noticed personally, and correct me if I'm wrong, I've noticed that most of the experts that we're seeing, dealing with this topic, at least here in Canada, tend to be male. Why is it that you think female infectious diseases specialists are underrepresented when it comes to being a so-called TV expert?
There have been studies that have come out looking at this, because it's not just something anecdotally that you're noticing, but the general public's noticing it. And even the Journal of American Medicine published something in December acknowledging the fact that even though there are a significant number of women participating in infectious diseases, there aren't many that are coming forward with the media. And there have been various theories, but I think the honest answer is I don't really know, because there are enough of us out there that are effective communicators, that are seeking these opportunities, and that have really strong and solid, credible information to share. And so I think it's probably multiple factors. And I think we all sort of share a responsibility to make sure that more women are represented in media, and that they're given the opportunity to share information from their lens as well. Personally, I think this is something that we can all work towards together, really, as media and as healthcare advocates, to make sure that when a viewer, through whatever media platform you're appreciating, sees someone that looks like them or speaks to their experience, they might be able to understand the seriousness of something, or the importance of participating, or the importance of following public health guidelines. Especially females that are of color, BIPOC populations. We need to, you guys are, during your panel, are talking about diversity and inclusion through several seminars throughout the day. But I think a woman's lens in this is also so important, and needs to be talked about more often, and we need to do better.
Gentlemen, any thoughts on that topic?
Yeah, lots. There's some incredible female infectious diseases specialists, and some of them are in the media, but by no means enough. And we've seen, for example, Dr. Susie Hota, Dr. Lenora Saxninger, Dr. Lisa Barrett. I know there's more, but those are the first 3 that come to mind. But, I can think of, a list longer than my arm of very, very talented female physician colleagues that are phenomenal communicators and terrific in the field. And I mean, oftentimes, if a journalist approaches me about a story or something, and I know someone else who might be better at this, I'll often flip that to a female colleague to take, because I think it really is important to get more voices and more diversity of thought, diversity of voices, and more women certainly in these conversations.
Yeah, I mean, I totally agree. And, like Isaac, at many points in the pandemic, I definitely, stretched my scope and took interviews and did a lot of media. But sometimes the best thing that I did, the best feeling I had was when I said, no, this person would be more appropriate. This person, is not getting coverage. You should learn about them. But, in the spirit of intersectionality, definitely, gender and race, but also thinking about, what is a COVID expert? I mean, there's no doubt infectious disease docs are an expert in a pandemic and throughout. But you got to think about the kinds of people that are being covered for sure, but who's not being talked about on radio, on TV, on digital, on print. And a lot of the times it was the people who were hardest hit by COVID-19. So I really appreciated when the media took that step to go out of mainstream circles to seek out health professionals and health workers who worked with marginalized populations who were being hardest hit. It's not just the specialty someone works with, it's the community that person works with. Yeah. But just like even taking that even one step further, I also would really recommend moving forward that the media starts to think about how we get people with lived experiences to be the experts. Because the experts, what is an expert? A person who got COVID, a community that got hit hard by COVID, they're experts in that experience. And these are longitudinal relationships with organizations and people with lived experiences. And it's just something we need to think about for the future.
Excellent points by all three of you. And I'll sort of give the other side of it, right? I mean, look, it takes two to tango, right? It's not just about what's going on in the healthcare system and any potential bureaucracy that might be there. It's, it's the media as well. We keep going back to the well. And I can tell you from our perspective at CP24 Breakfast, we had Dr. Bogosh on because someone had seen him somewhere and had his contact. And this was the early days of the pandemic when we were still wrapping our head around, is this 2 weeks or is this 2 months or what is it? We did a hit with Dr. Bogosh once in Japan. And little did we know it wound up sort of being your audition, and none of us knew it at this time, because then when we realized we had to pivot to make this a regular daily conversation, in our post-production meeting, what about that guy we had on a couple of weeks ago? He was really good. Dr. Bogosh, let's reach out to him. And then all of a sudden it became a daily thing. And so we just kept coming back to the well because you were really good at it. So that's sort of the story from our side. Dr. Dasani, next one's for you. I mean, really, this is for any of the three of you, if you guys want to weigh in, but I'll start it off with Dr. Dasani. The amount of new information, studies, recommendations coming out every day. I know it's kind of slowed down now, but really when, sort of the meat of the pandemic, right in the middle of it, it was overwhelming, right? I've kind of likened it to trying to take a sip out of a garden hose. There's just so much coming out and you're trying to process the important stuff. What's it been like for you in terms of, on social media and then also on, in real life, trying to digest it and understand it and then spit it back for the general public and even us journalists? I mean, we're not that smart. So how do you do it?
Well, first of all, I think you guys are very smart, super talented. And I don't know how you guys do this every single day because it's hard. And, I just here's a picture. I'm covering, the consult service in hospital. I've got like 3 pagers in front of me. I'm on the phone. I'm dictating. I'm seeing people in the unit. I got 4 consults pending in the emerge. And then, a journalist DMs me, hey, we're doing this story and blah, blah, blah. And it's like, okay, cool. But like, I haven't even heard about that storyline yet. I get on Twitter, like I'm just digesting in real time. Like this is the real flow of what it's like. And, I think there was this collective desire to get information out during this pandemic and do it properly through science with respect to all parties and all perspectives. And, it was challenging to be able to balance clinical work, as my colleagues have talked about, but then also digest like a new study and, and there's different perspectives on different things, from the variants to like, what policy we should do to move forward, to how different people are being impacted. And that was really, really hard. So I'm sorry if I took time to respond to your DMs. My bad. Like I was really trying to be on it, but sometimes there's just other stuff on the go. And that's just kind of how it all, came through.
Dr. Bogosh or Dr. Murthy, thoughts on, turning that information around and sort of reverse engineering this process, right? It used to be the studies would come out, you'd process it, and then we'd come to you. And now it's like, we've already got the information and we're coming to you and you may not even have heard about it yet.
Yeah. One other comment on this that's really interesting is, I think the three of us have spent a ton of time on the wards, especially on the COVID units. And when you have new information coming out in real time via press release, not even a preprint, like a press release, it's extremely challenging. I remember I was on the wards, on the COVID wards, when we had a press release with dexamethasone and being an effective drug. And like, you don't have any information. You have literally a press release with not even close to enough information on whether or not you want to integrate this into your clinical practice. And literally within 2 hours of that press release coming out, patients on the wards and their families were asking us, should we go on dexamethasone? Should we go on dexamethasone? And the answer is, we have no idea. Like, I don't even have data at my fingertips. Forget that it's not peer-reviewed preprint data. I don't have any data. I have like 5 lines in the BBC telling me that this works. Same thing happened with remdesivir as well, and just about other things. It's been very, very challenging with the rapid pace of discovery and trying to sift through what is meaningful, what is high quality, and what is garbage. And then, of course, trying to integrate this into your clinical practice in real time to be meaningful. And then, of course, trying to explain it to the general public, where you have to communicate uncertainty around so much of this as well, because there's so much uncertainty just on about every aspect of it. So I think it's very challenging at best because of obviously there's the pace of new knowledge, communicating uncertainty, the rapidity at which information is moving, and then of course the constant pivoting. And that's, I mean, we've all done it, and we're all trying the best we can to keep up. But it is challenging for sure.
Yeah, it's jarring because you know there's a responsibility now that's in the hands of the press with what information they're sharing at the outset, because that goes into our patients' hands, and then we're expected to act upon it. To that dexamethasone example you just gave, I've had a patient who we explained there was no evidence to support one of their therapeutics, and they went and obtained it elsewhere from a pharmacy without our advice because of the information coming from the press. And this is not a blame game by any means. It's just a recognition of how important you are and how important media is in communicating this information. And I mean, the science by press release has totally rocked our world. And I just don't know how you guys have fared with it, but I think it's insane that now we have peer review on Twitter, and that's what we're doing with these studies that are coming out. We're not sitting at an academic center at a table, dissecting it, looking at validity, how important this outcome is. We're just saying, okay, we got to run with this because now it's out there. And so it's a different game altogether.
Was that therapeutic? Does it rhyme with schmivermectin?
Close enough.
Yeah, okay.
If you can find any, let me know.
That's a really good insight from all three of you there. I do want to get a little bit personal, I guess, with these next couple of questions. Dr. Bogosh, you know, I am curious as to how your life has changed since the start of this pandemic. As we've already touched on, you've been doing this daily hit with us at 720, and you know, I don't know if you check all your your mentions and your DMs because you got better things to do, but I think the thing people have really come to appreciate about you is that you answer quite in a really scary time, maybe the scariest time in all of our lives. You've been answering questions in a really calm, sensical, and perhaps most importantly, apolitical way, right? You take all that nonsense out of it and you just get right to the bones of the issue. And, I can't tell you how many people have told me 720 is, I host a 4-hour show, but they tell me 720 is when they make sure they're tuning in. It's gone from sort of background morning viewing to appointment viewing from 720 to 730. We open up the inbox for questions for you, for Mayor John Tory, for various other guests. And the producers are the ones who sort through that, and they tell me they get more questions for you, hands down, than any other guest we have on the show across the board. Sometimes those questions are offside. People want to know about your personal life, and we don't put those ones to air. But I just want to know, are you comfortable with this level of attention? Are you getting stopped now in the produce aisle? Like, what is your life like when you're not here on TV doing this?
So a couple points here. First of all, I'm proud of us. Like, this is a team at 720, and you've been fantastic to work with. And I know we text each other once in a while and sort of coordinate once in a while, but it truly is a team, and it is a team effort. And you've been wonderful to work with this entire time. And I know it's really sad that we've never actually met in person, and I can't wait till we do. And I think that's coming sooner rather than later, given the trajectory that we're headed in Ontario. The second part is that I do appreciate that this gets a lot of attention. And again, just related to point one, I'm proud of that. I think we are doing something good here. I think we're providing, as best as we can, valuable information to the general public who is hungry for apolitical, factual information. And, I'm not always perfect. You're not always perfect, but we do our best. And sometimes we make corrections along the way. We really do our best to do that. The third part is, we touched on it this morning at 7:20, but I think I think as the fog lifts and as we start to move back toward normalcy, it's probably going to impact all of us, whoever has been in the media. It's probably going to, we'll probably get recognized more and more because we've been on TV or on social media a fair bit. It started a little bit, if I'm out with my family or something like that, I'll get recognized here and there at a grocery store, in a park or something, or a playground if I'm with my kids. Once in a while someone takes a selfie and that's that. But in all fairness, though, it's since February of 2020, it's been insane. It really has been insane. And when I say insane, I'm talking 14 to 16 to 18-hour days every day. And it's just busy. I don't go out. I don't do anything. And I spend time with my family. But once everyone's in bed in my house, I'm literally up until the wee hours of basically up until I fall asleep, answering emails and getting work done. So I don't think it's actually hit many of us, but I don't want to speak on behalf of others, but I don't think it's really hit any of us yet as to what this actually will mean, because the fog hasn't lifted, but it's starting to lift, and we'll probably get recognized when we go out and about, and that's great. I think the positive attention is lovely. I'm not sure if you're going to head in this direction later on, but there also is negative attention as well, and harassment online or whatever. And again, everyone deals with that their own way, but I think it's too soon to tell how this is truly going to impact us, but we're going to know soon enough because we're clearly coming out of this sooner rather than later. So maybe we should touch base on this in July or August when we're out and about more.
Yeah. Oh, and don't worry, we do have a troll segment that, if we got time for it, we'll squeeze it in before this is done. Dr. Murthy, I want to get back to you here on a personal note. You sort of touched on this. You alluded to it at the beginning of this discussion half an hour ago. You've had an extremely unique COVID experience. You actually gave birth over a year ago in the early days of the pandemic to baby Serena. Let's get some cute factor here. I believe we do have a picture of Dr. Murthy with baby Serena. Let's see that.
Where is she?
Oh,
come on.
Congrats.
Adorable. And Serena's over.
Pumping in a pandemic.
So awesome.
Serena's over a year
so
now.
Cute.
And just adorable. Now, look, Rishi, I want you to take us back to that time, right? Because it was extremely scary, right? You're an infectious diseases specialist, but at that time, we still did not know much about the virus, right? This is when we were wiping down groceries and hoarding toilet paper and worrying about touch points. Vaccines weren't even a part of the conversation at this point. Sometimes maybe ignorance is bliss, but I imagine this must have been especially hard for you, knowing all that you know in your profession and giving birth in the early stages of the pandemic. What was that whole thing like for you?
Absolutely. So my daughter was born in April, so that was wave one. And I was 35 weeks pregnant when we started this concept of physical distancing, isolating, etc. And so I was actually kind of excited. I was excited. This is my game. Put me in, coach. I was totally excited to be a part of the team and help out. Slowly but surely, in my clinical care at around 35 weeks pregnant, I became symptomatic with a respiratory infection. And so I had to get tested for COVID and I had to isolate, which sort of totally changed the game for me personally, because here I was all week long, all 2 weeks actually. Well, it went by so quickly. Getting the hospital prepared, getting our patients organized, figuring out what is remdesivir, what is hydroxychloroquine, what does that mean for the pandemic, all these new drugs that we were hearing about back then. And on a personal note, I was, doing my best to keep up with my professional responsibilities. But the second I got sick, everything shifted mentally. The whole, there's 8 pregnant women in Wuhan who did just fine was not good enough for me anymore, because here I was thinking that I myself was about to get sick with something that I didn't have any expectation for. And it's funny thinking back, because people don't realize that infectious disease doctors do take on a bit of risk on a day-to-day basis when you're doing inpatient care. And I'd walk into a patient with possible measles, no big deal, walk right in, no issue, pregnant. I do the same with the person that had multi-drug resistant TB. Whatever, I can do this. The second this big question mark came up, it changed the game. And so then I had to peel back on what I could do in terms of patient care. I had to, bow out of media opportunities because I was just troubleshooting how to go about having a baby in a pandemic. I remember my gynecologist told me that there was a chance that my partner couldn't be with me when I had the baby, and was casually suggesting I could use Facebook Live or something like that or instant FaceTime or something to have my husband watch the birth of our firstborn. And that was wild to think that those were the conversations we were having back then. So yes, incredibly unique at the beginning of the pandemic, trying to troubleshoot how to have this baby safely with all these variables up in the air. As the months have gone on, we've certainly learned more about what being pregnant in a pandemic means. And a lot of the advocacy that I've turned to is really for my sister, who became pregnant 3 months after I delivered Serena. And I wanted to make sure that she was up to date with all the information that she needed as a former RTDNA board member herself. And so I wanted to make sure that she was up to date with the information she had. And that's when I connected with some very strong women physicians that were advocating for pregnant women throughout the province. And I've sort of taken on my journey from that. So I give Serena full credit for my participation in media today.
I appreciate you sharing that very personal story. And yes, shout out to your sister, who is a wonderful producer of breakfast television. You guys both gave birth in a pandemic. And I'm just glad that, baby Serena will not remember this, but it's a great story you can tell her when she grows up, that she was born in the midst of a pandemic. That's just stranger than fiction. This next one is for all three of you, but we'll start off with Dr. Dasani. And you alluded to this, Dr. Bogosh. I do want to know about trolls on social media. Look, when I decided to join media, I kind of knew this is what I was signing up for, right? I'm putting myself out there. I'm an easy target. If people are upset in their life and don't know where to take it out, hey, the person on TV, that's an easy lightning rod. You guys did not necessarily sign up for that when you chose to get into your profession, but here you are. How do you deal with it? Dr. Dasani?
Yeah, I mean, I think it needs to be said that, being in the public eye and being a TV doctor or a media personality has attracted all sorts of negative energy on a spectrum. I've personally become the target of anti-lockdown communities, anti-mask communities, anti-vaxxer communities, and, all in the name of supporting, evidence and science. And many of us have been targeted in different ways. I've received, random phone calls. I've received voicemails at my clinical places of work. I've received nasty emails, but I think, as someone who advocates for communities who are often, marginalized and who have been hardest hit by this pandemic, we must remember we may have all weathered the same storm, but we were not in the same boat. It's a different kind of experience for me, because I particularly went out on a limb and have no regrets in doing it, and in advocating for racialized communities, and advocating for those who didn't have homes, and advocating for those who experienced poverty. And that really brought a certain demographic of target on my back, and it was white supremacists and racists, and I alt-right kind of like targets on me. Remember, this wasn't just COVID-19. We had George Floyd, we had Black Lives Matter, we now have 215 children an indigenous a grave in Kamloops. So there's like, these stories are intertwining, and as a health equity advocate, it brought out some of the worst in Canada, and it took a toll on me at different times. But I'm always reminded by the people I care for on the streets, in shelters, around the importance of health equity, and it's just a reminder of why this can never stop, and we need to keep it going. That's
really well said, Dr. Bogosh.
I'll start with saying I fully appreciate that anyone in this field who's in the public eye will no doubt get some negative attention, and I completely appreciate that it's often women that get significant negative attention that's disproportionate. It's often people of color that get significant negative attention in a disproportionate manner. And I also appreciate that we all interpret it and respond to it in our unique way. So let's just get that out of the way. In my own view is that, yeah, I get a ton of it. Through social media or direct emails or letters and stuff like that. Again, I'm just being honest here. I don't care. It doesn't bother me. It doesn't. I literally turn off Twitter and the problem goes away. Or I delete the email and the problem goes away. Or I open the letter and I throw it away and the problem goes away. And again, that's a very uniquely personal experience. I want to really reemphasize that I completely appreciate that this impacts others differently, and especially women and people of color, and we all respond to it in our own ways. I mean, and it's not entirely fair. Like, I've had some pretty nasty, like there was one, I don't want to get into too many details on a public forum, but like there was one that was like a possible credible death threat where I had to call the police, and they were like, yeah, this is a possible credible death threat. And, you know, we had police over at the house. Like, that's a tough one, because that's beyond me. Now it's impacting my family. And that was very challenging. And that one was very, very challenging. And so fortunately that's, you know, one unique experience. It was pretty bad. You think of yourself like, how am I going to explain this to my wife? Like, this could be a tough conversation, which it was. You know, when you're sort of asking like, maybe we should stay in a hotel for a few days, kind of thing. But in all fairness, that unique one aside, the rest of it, I just brush it off.
That's absolutely terrifying. I appreciate you sharing that, and that is certainly not what you signed up for at all. I do want to get to sort of clickbait journalism, because I know that was a big topic pre-pandemic, but it's certainly been exacerbated in this pandemic. Look, we're living in a society that's predicated on immediacy. Everybody wants stuff right now, and that can work in our favor in disseminating information, but it goes both ways, right? I mean, with social media and just sort of reading headlines and not reading the full story, it can be pretty dangerous, especially when people are looking for sort of confirmation bias. And, you know, the algorithms we know that sort of dominate our social media feeds. I do wonder how you guys have navigated and combated clickbait journalism over the last year. Dr. Murthy, we'll start with you.
So I think it's always about looking at sources that are credible, and to double check where your information is coming from. And I think we have that responsibility, the media has that responsibility, and the individual has that responsibility as well. I think it's so easy to get an infographic these days and to try to look at something, and it stirs an emotion, it stirs a response. And it's important to recognize that that infographic needs to also be filtered through and validated by someone. And so check your references, check who's giving that information, and make sure that it's accurate and to the point. I think the responsibility of the journalist is to make sure that when you're representing this information, you're doing it with authenticity and that you're getting it from the right people. If you have a specific question about palliative care and the elderly and the homeless, you definitely want to find someone like Dr. Desani to speak to that directly. Would he be your go-to for, I don't know, maybe you have a molecular genetics background that I don't know of, but if that was something that he was an expert in that you had a question about, you should ask him that too. But if it's not, then it should go to the next person. And that's how we sort of break the cycle of this clickbait, inflammatory titles. We need to keep it to the point, and we need to keep it clear and honest.
Dr. Desani, did you want to chime in there?
Yeah, you know, I think once you've done that, because, you know, Dr. Murthy really, you know, brought that to the forefront. I think once you have the acknowledgement that you've looked at the evidence, you understand the science, you've done justice journalistically and medically, you know, to present this information, then, you know, lean on the power of storytelling. We often in medicine move away from an N of 1 because we're in an evidence-based medicine world. A sample size of 1 is often looked down upon. But sometimes the most powerful thing you can do as a journalist is to put a face to a name, put a face to a story. And we've talked a lot about case counts and hospitalizations, and, you know, the public was getting numb. And I think they still are to what these numbers even mean. These are real people who got sick. These are real people who died. When you connect with the public and you've done it from the evidence-based perspective and you get that story, you have the power to really, you know, create behavior change. And when it came to staying at home, when it came to masks, like, you guys did this. Like, we were definitely here, you know, advocating and doing these interviews, but you guys did an excellent job throughout this pandemic in translating this information and using data and stories to keep Canadians healthy. I think, you know, to take it even one step further, when you start to tell stories of those who weren't necessarily covered, you have the opportunity to actually create policy change. You can actually change the way the world works. And I think there's potential space between healthcare and health workers and the media. It's just so much smaller. Like, we all got really close during this pandemic. We're definitely all gonna have to go out for chicken wings and a beverage after this. But really, just to say it, it's just so many levels to it. And I just want people to think that through when this pandemic is over too.
That's really well said. And, for everyone watching right now, I just want to let them know, I know you've been sending in questions. We're going to open up questions in about 4 minutes, 5 minutes. We'll save about 10 minutes for questions. So that is coming up shortly. But in the meantime, we'll go around the horn here again. Look, I know it's always different when you're on the inside of something versus the general public just sort of consuming this on television or in real life. But, and you can be honest here, when you're watching the way this is playing out on, through the media and on television, do you think that this pandemic has generally been captured correctly, or are there times you're sitting back and watching thinking, oh geez, they have this all wrong, or that's just the tip of the iceberg. That's only 5% of the story. Dr. Bogosh?
In general, I think the Canadian media has been very good, and I consume a lot of Canadian media, but also American and European, and I think in general it's been fairly decent from the Canadian media. Now, obviously, sometimes just by virtue of some of the roles I've had during this pandemic, I sort of see what's happening behind the curtain, or have a role in that as well. And yeah, I mean, your point's well taken. Sometimes you're watching someone give an interview or present something, and you think like, no, this is framed completely incorrectly, or like, maybe technically it's true, but the emphasis is not really appropriate. But I would say that's a significant minority of the time. And in general, I think it's as fair and as honest as it can be. So, and then that's a huge credit. You look at, for example, if you compare it to the American media, I think we've navigated this, or not we, you, and the Canadian media have navigated this in a much better manner compared to your colleagues elsewhere in the world.
Okay, that's great to hear. This next question I'm going to put to Dr. Dasani and Dr. Murthy. It's sort of in the same vein of what I just asked Dr. Bogosh, but it's time to sort of flip the mirror back on us, on the journalists, and for the journalists who are watching this session as well. Now, I will say as a disclaimer, go easy on us. We all have fragile egos inherently because we ended up in media. But how do you think the journalists have handled a story that's been changing and evolving so quickly in the era of the 24-hour news cycle and the demands of immediacy that we just talked about? How have we done? And you've been watching us and working with us up close and personal. What advice might you have for us, Dr. Dasani?
Through and through, I would say that the media in Canada did a really great job throughout this pandemic. I think what I'll say is I'll give two examples where I thought they went beyond just like translating science and translating public health information. They got into the human experience of what it was like to experience COVID. I'll talk about long-term care. Here in Ontario and other provinces across Canada, you guys kept on that file. You kept pushing. You kept our elected officials to task. You asked the hard questions, and that was very, very important. And it will be important moving forward as we think about long-term care transformation across this country. Another example is when, in various provinces across Canada, people experiencing homelessness were not prioritized for vaccination. It's a smaller population, I know, when you're thinking about the whole country, but given that people experiencing homelessness were 5 times more likely to die from COVID-19, this was kind of an important issue, especially for someone like me. And I think what it really showed is, the importance of covering issues that spark dialogue and not being afraid of advocacy, whether it's controversial or not. I mean, stick to your journalistic standards without a doubt, but you truly can make a difference in the lives of those with less privilege. I think my advice moving forward to capture the human experience is to think about these stories through an anti-racist lens, to think through an anti-oppression lens, and to really think about anti-colonialism in everything we do. Who's at the table, who's not at the table, and if they're not there, how do we get them there to share their views? The best part about coverage throughout this pandemic was when the media really covered what the human experience of what it was like to have COVID-19 above and beyond case counts and numbers.
Dr. Murthy?
I was going to say that, again, I'm so proud of Canadian media and what you all have done so far, but to enhance that and to grow on the skill set you've already acquired, I'd encourage you that when you're interviewing any medical expert, anyone that has a medical background, to ask them the question that you have multiple times. Don't just settle for the first answer that you get, because we're awkward. Sometimes we need another shot to answer things properly, to give you that headline that you need. Like, give us a chance to give you the line that you need to sell your story, but with a credible and accurate lens. I'd be happy to answer that question in multiple forms, and I'd be happy to give it another shot because you might get your objective met a little bit more easily. But in general, I think the vast majority of journalists have done an excellent job at trying to relay the human experience, deliver the health advocacy piece, deliver public health messaging, and try to give the general public a pulse and a slice of what's happening, at least in terms of care in the Canadian healthcare system as it stands right now.
May I add one thing?
Go ahead, yeah.
I mean, I don't have much, I'm not one to give advice, especially to a profession where I don't know anything about, apart from chatting with you and many people who are probably watching several times. I think one key thing here is vetting experts. That's just a major, major issue, is vetting experts. And I appreciate that, you know, people might have an MD or a PhD behind their name, but that doesn't necessarily mean they know what they're talking about, even if they have big credentials or, you know, some significant academic pedigree. And we've seen this time and time again throughout the pandemic. And it's not uncommon. In fact, another way of saying it is it's common to see people who are perhaps a bit over their skis and opining on things that are, they can talk about, but perhaps there's other people that are better suited to it. I think like Twitter followers, both high and low, are not reflective of one's knowledge or expertise. And I think we see a reliance on, people's social media presence for, engaging in that narrative and bringing it into the media. And that's often not reflective of the ground truth or reality. And I find that, it doesn't happen all the time, but it happens frequently enough. And I think this is a significant issue. So I think that's one thing to take note of. Ruchi, it looks like you want to say something.
I was just going to add to that. And the JAMA article that came out, it commented on the fact that female physicians are less comfortable stepping up and speaking to something that they don't know than male colleagues. And maybe this is why we're starting to see a bit of a discrepancy with how many women are at the table right now in media. And so I think that's such an important point. And I think as healthcare professionals, we need to take ownership of the fact that we need to acknowledge what we don't know and step away, as Nahid had mentioned, if it's not in our lane, to make sure that the right experts are coming forward and speaking. So that's such a good point that you just made.
The amount of time we've had to talk down people from the edge of a cliff completely unnecessarily because issues were unnecessarily amplified from a 2 out of 10 issue into an 11 out of 10 issue because someone said something on social media that made its way into media that exploded, that was, an issue, but not an issue. I mean, this has happened countless times throughout the pandemic, and it's just unnecessary. It creates unnecessary anxiety.
Excellent points by all of you. There was a lot there. Appreciate all of you weighing in there. I do want to squeeze in some viewer questions with what time we have left. I'm going to do this just based on which questions have been upvoted the most. I'm not on Reddit, but upvoting is a thing. This first one is from Nick. Mick says, after being in the pandemic for 15 months, from this panel's perspective, are there any stories or subjects related to COVID-19 that have not been covered or have not been covered enough? Dr. Dasani, do you want to start?
I think I would be really remiss if I didn't talk about the opioid overdose death crisis. We've seen an uptick in opioid overdose deaths in Ontario and across Canada. And meanwhile, we've seen political ideology lead to a scaling back of the kinds of services and supports that would help people, including harm reduction and safe supply supports. Definitely, a recent report here in Ontario got some coverage, but due to a tainted drug supply and a lack of, government support, people are dying. We saw a coordinated health response around COVID-19, and it's deeply saddens me that we have not seen a coordinated health response around the opioid overdose death crisis, a crisis that was human-made, that many would say was created by healthcare in many ways. I know it's multifactorial. So this is not just a failure. This is a moral and ethical failure on the part of medicine and healthcare. And I think it would be really great if the media would continue to cover this. The second area I would talk about is the ongoing criminalization of poverty. We saw throughout this pandemic the ways that people in encampments were treated. People were, getting tickets. People were getting fined. We saw over policing on the poor. Check out Policing the Pandemic. Just Google it and you will see the rates, and it's a real thing. And the ways that many cities and jurisdictions across Canada are actually coming down and kicking out people from encampments who are just chilling in their homes, trying to hang and trying to live through this pandemic because they feel it's unsafe to go into, the shelters that have been created. Put some stories down on this. Reach out to these communities. They need your help. They need your support. I'm here if you need a connection. I think those are some important stories that need to get talked about.
Next question comes in from Alekia. Alekia says, given the fact that all of you are employed by a hospital, how does your hospital react to being on TV, especially if your views contradict their view? Dr. Bogosh, we'll give you that one.
I'd love to discuss this one with you offline after the pandemic settles. So
Fair.
There's one point.
Okay.
Second one, 3 topics related to question 1. Origin of the virus in a non-xenophobic, non-political manner. Children mental health issues and ongoing child mental health issues in the months and months to come. And then how the pandemic is manifesting in low-income countries and globally. Those are 3 big topics that are extremely important. We've heard a lot about India, Brazil, which aren't technically low-income countries, but there's a lot of COVID globally. Hospital stuff, I don't know. We'll save it for later. I'm punting on that one.
This next one is for all of you. If you guys want to weigh in quickly on this, it says, this is from Joe, who says, hi, Gurdeep. When do the doctors predict we will have our first national holiday where we will say this feels normal? Will it be Canada Day, Labor Day, Thanksgiving, Remembrance Day, or Christmas? This feels like you're on a betting website.
Thanksgiving.
Dr. Dasani?
Yeah, if I had to guess, I would say Thanksgiving. You're right. It's kind of like Price is Right here, but yeah, I'll go with Thanksgiving.
$1.
I'm gonna stay in my lane and leave this one to the epidemiologists.
Okay, fair enough. All right, let's go here to, this next one is from Ashley, who says, what's the most effective way to tackle an important topic, safety of schools, prioritization of vaccines, without creating a polarizing environment? Who'd like that one?
I have a lot to say on that, but in 10 seconds or less. Number 1, vet your experts. Number 2, related to what Naheed was talking about earlier, get a very broad range of voices into that conversation.
I'll jump in and just say very quickly, don't be afraid of being polarizing. We know that what makes people sick is often social, and what defines the social determinants of health is political. So if you're getting political with an issue, that's probably going to help a lot of people who don't have the privilege to be able to be covered, to be able to be reported upon. So you're helping racialized communities, you're helping people who face health inequities in our communities. So don't be afraid of the polarizing bit. It might just be what's needed to get the issue to the forefront.
Well, what about just be honest? I mean,
yeah,
people will polarize things one way or another. Just be honest. Stick with the facts. Stick with the facts. Just be honest. And sometimes it might not align with an individual's ideology or political views. Great, just be honest. Just tell a story. And that's why getting so many different voices into the mix is extremely helpful. And sometimes you hear that there's truly a voice that is 2 standard deviations beyond the mean. And you dig a little deeper and you see, well, this voice is 2 standard deviations beyond the mean for just about everything else. Maybe there are other voices that are better. So I think vetting experts is extremely important. But yeah, as Naheed talks about, is sure this things might get tense because there's differing opinions, but as long as we're honest and stick with the facts, I think we're doing okay.
Evidence-based medicine.
I'm going to combine 2 viewer questions for this last one because we're up against it time-wise, but these 2 questions are sort of in the same vein, so we'll go quickly around the horn here. The questions are from Janice and from Shelley. Do you think the rise of the TV doctor is here to stay? And if you were presented the opportunity to have your own TV show, would you go for it? Dr. Murthy.
I don't know. That's never been a question that's really come to me. I hope that it's beyond COVID. And I think that creating platforms for people to have their voices heard should be present. And so if that opportunity were to present itself, I'd be curious. I'd want to know what it's about. Yeah. And I think the TV doctor should be here to stay.
Okay. Dr. Dasani?
Yeah, look, I'm really excited about this potential space that's been created around healthcare and media. There's going to be a lot of healing that needs to be done after this pandemic around grief, around mental health, around, you know, all forms of recovery, and our health is going to be paramount in that. So I'm super hopeful that this continues. You know, I'd partake in any project that, you know, aims to address health equity in our community and communities and address those communities that were hardest hit by this pandemic. So count me in if that's a part of it.
Dr. Bogosh, last word to you.
I'm just going to, I don't mean to be a contrarian, I'm just going to differ from my two friends and colleagues here. You know, I've had people sort of kick the tires on this question a fair bit. I honestly don't know how I think about it, but quite frankly, I'd be very happy to fade back into obscurity and get back to the work I was doing before.
Okay, not what I was expecting to hear from you. And it's
oh, sorry, Gurdeep, you and me will do a show.
Okay, there we go. I mean, listen, as soon as this is over, I'm pitching to Crave. Coming to you this fall on Crave. We got to come up with a name for it for this bromance.
I don't know how I feel about that.
We'll talk about it offline, as you say. Hey, listen, we know that you guys have much more important things to be doing, so thoroughly appreciate your time. Dr. Murthy, Dr. Bogosh, you guys are at work right now, so thank you. And Dr. Dasani, thank you for taking you know, some of your personal time off to do this for us. We really appreciate it. That was super insightful for myself. I hope everybody enjoyed it watching virtually, and thank you for all the questions here. We did as best as we could. Thanks so much to our panelists. Really appreciate it. And right now, these are some of the oldest words in broadcasting. And now, a word from our sponsors. And while we reset for our next panel, we do want to thank some of our many sponsors because their generous support is what made this conference possible. Two of them provided videos describing what they do and how they overcame the challenges of working in a pandemic. So we'll start there. First is DeGero, a longtime RTDNA Canada supporter, well known to our industry for their live video transport and real-time data transfer solutions. And Blackbird Video, who provide professional video editing in a web browser. We'll see you back here shortly for the next session, which will be hosted by Reshmi Nair. Stay with us.